Hi YouTube, my name is Savannah. Today I will be bringing you a video explaining sickle cell disease, what it's like living with sickle cell disease, and my experience, everything I've gone through, and what helps me. And I'll be also giving information on everything about sickle cell, what there is to know, what you need to know, things that can benefit you, and everything like that. I wanted to make this video because I searched up on YouTube what it's like living with sickle cell and things dealing with sickle cell, and nobody really has a sit down video talking about it. So I wanted to be the first and to bring you guys this video. I'd like to give a little background on why I actually want to make this video and wanted to make a little series of. I actually have a sickle cell page and I talk more about my experience and stuff like that, so you can actually follow it. I'll put the name right here. I attend Tuskegee University. I'm a freshman. I keep saying after Tuskegee University, I'll be going to medical school and I will become a pediatric hematologist, and I would like to specialize in sickle cell disease because I want to find a cure. I want to find another effective cure. And yeah, I want to find an easier, effective cure, and I just want to help people who experience the same thing as me. So that's why I made this video. That's why I'm making this series. And yeah, I just want to help. So yeah, a lot of people who have sickle cell, they don't talk about it. So that's why I'm going to make this video. I would like to say that this video is helpful if you A, have sickle cell disease, B, know somebody with sickle cell disease, C, have the sickle cell trait, are about to have a child and you know that they are going to have sickle cell. So let's just get into the video. The first thing I would like to talk about is what is sickle cell disease. Say you clicked on this video and you don't even know what I'm talking about. So sickle cell disease, the definition they give you on Google is sickle cell disease is a severe hereditary form of anemia in which a mutated form of hemoglobin distorts the red blood cells into a crescent shape at a low oxygen level. Now, this is what a normal cell looks like, and it goes through the veins properly, no problems. Now, this picture is what a sickle cell looks like. And as you can see, it's a crescent shape, so it goes through the blood vessels, really jaggedy, it hurts, it scrapes the blood vessels. There are different types of sickle cell. There are 3 different types of sickle cell. There's the sickle cell trait, which has no effect on your day-to-day life. The sickle cell trait, you have the sickle cell trait and you're about to get married and your husband also has a sickle cell trait. There is a percentage that your child will have sickle cell disease SC. So that is, in my case, my mom had the sickle cell trait and my dad also had the sickle cell trait, and I want to say it was a 25% chance that I would get sickle cell SC, which I have. So yeah, sickle cell trait, you're not really affected by it unless you get with someone that has the sickle cell trait as well and you guys have a child. The next form of sickle cell disease is sickle cell SC, which is the type of sickle cell that I have. Sickle cell SC is where you get all the pain that comes with it, and everything that comes with sickle cell, you get it, but it's a percentage. I want to say that your blood cells that are crescent shaped and that are sickled are less than people who have sickle cell SS. So I would like to say it's a little milder than people who have sickle cell SS, but everyone truthfully varies. The next and the last type of sickle cell disease is sickle cell SS. Now this is the, I'd like to say, how do I put it? This is like the highest level of sickle cell, I would say. You have more sickled cells than someone with sickle cell SC. A lot of patients who have sickle cell SS are usually in the hospital a lot, blood transfusions, a lot of pain crisis. So I'll touch bases on what all of that is in a second. But sickle cell SS is the harshest form, I want to say, of sickle cell disease. Now that we've gotten to the different types of sickle cell disease, I want to get into the things that come along with sickle cell disease, such as acute chest, sickle cell crisis, and blood transfusions. There are also other several things that come along with sickle cell disease, but these are the main three. Now, acute chest results of sickling in the small blood vessels in the lungs causing pneumonia. Now, if you go back to what I said earlier, sickle cell, your cells are shaped sickled. They're in a crescent shape, like a C, like a sharp C. So with sickle cell, you can get sickle cell pains in your arms, your legs, and what that is basically blockage. It's basically blockage. The cells are in a C, so it's harder to go through the veins. And you can also get it in your lungs because you have blood vessels and veins in your lungs. So that results in acute chest / pneumonia. This one is very, very harsh, very bad. This also, I know when you have acute chest, it doesn't go away. It goes away, but your lungs will always remember you had acute chest. So your lungs will always be different than what they were before. Me personally, I have had 4 or 5, it might even be 6, I can't even count how many times I've had acute chest, and I've had to go to the hospital with acute chest. And so sometimes it can result in heavy breathing. You're breathing heavily, and you'll probably also get pain in your arms and legs. That's what happens to me a lot of the times. So that is acute chest syndrome, acute chest. The next thing is sickle cell crisis. Now this is the most common, the #1 common thing in people that have sickle cell disease. Sickle cell crisis is a painful episode. So like I explained, your cells are in the shape of a crescent form. So it's harder to go through the blood vessels. So it's scraping the blood vessels, it's giving blockage. And this happens, it can happen in your hands, your fingers, your legs, your arms, your limbs. That's where it can happen in your feet as well. For me, it usually happens in my arms and legs, and sometimes my fingers and my feet. It's very painful. When I explain to people how the pain feels, I usually explain to them like it feels like a stabbing pain, like somebody is just repeatedly stabbing you in the area that you're having pain in. You can also take medication. You can take medication for pain crisis or pain, that sickle cell pain. You can take medicine for it, prescribed to you. I'll get into that also. And there's also several ways you can prevent having a pain crisis. Now, things that trigger a pain crisis. Cold weather. If you go outside and you're not wearing a jacket or you're not wearing your proper gear for outside and it's cold, that triggers it. That, for me, that's the #1 thing that triggers it. Cold weather. Like cold weather. Also, when I go swimming or when I'm on vacation or anywhere where they have a pool or something, and say I go swimming and I get out of the swimming pool and I go back inside, and usually when you're staying at a hotel, it's cold. So usually when I go swimming, it results in a pain crisis. So I try to stay away from swimming, but if I do swim, what I do is make sure that I am dry right after I hop out of the pool. Get the towel, make sure you're dry, and then go inside. And you want to take a shower and change immediately, because as you know, you're going from a hot place into a cold place, because usually hotels are cold. Or same thing if you're going from a hot outside into your house, it's like a transition of weather. Also, extreme heat can cause pain crisis, but it doesn't really, that's not really the number one thing with me. The number one thing with me, like I said, is cold weather. So typically during the fall is where a lot of my pain crises occur, because the weather is changing. In the fall, you transition from hot kind of cool weather to cool cold weather. So that's where I have a lot of flare-ups with pain crisis. Sometimes I get acute chest, things like that. Another thing that can cause pain crisis, exercise. Yes, exercise can cause pain crisis. If you overexert your body, it can cause pain crisis. Physical activities, yes, cause pain crisis. Like I said, you just have to know your body, and you have to know when you need to stop and when you need to take a break, when you need to take a water break. And that's something you say if you're having if you know you are having a child that is going to have sickle cell disease, or say you do have a child that has sickle cell disease, you need to talk to them about this, because when they do a sport, I know from experience, when I used to do sports, say PE, a lot of times I didn't want to feel, as a kid, a lot of times I didn't want to feel like the odd one out, which is bad, because you have to tell, please inform your kids. You have to tell your kids to make sure, because the parent is not always going to be there for them. So you have to tell your kid to make sure to communicate and tell their PE instructor or their basketball instructor or anyone in general. I know extra activities, usually you have a physical, but sometimes they do not read over it and read over what you have. So make sure you tell your kid to make sure that they tell the PE teacher or whatever activity teacher they have that they have sickle cell, and that they have to go get water more frequently than others and take breaks more frequently than others. Because I would try to be normal, or I didn't want to seem different than anyone else, so I would try to overexert myself and not tell the teacher and stuff, so that would also cause pain crisis. Another thing that can cause pain crisis is stress. Now this one I have seen a lot with my schoolwork. High school and college. This semester was my first semester of college. Stress really triggers pain crisis. Be stressed from anything. Stress from work, stress from not knowing the answer, stress from schoolwork, stress from I don't know what I'm going to do next. Like any type of stress can result in a pain crisis. Those are the main things those are the main topics that I discussed that can result in pain crisis. The next thing I would like to talk about is blood transfusions. Now, blood transfusions are very common in people who have Sickle Cell SS. People who have Sickle Cell SC also get blood transfusions also, but this is most common in people who have Sickle Cell SS. Me personally, I have never had a blood transfusion, thank God. But yes, some people with sickle cell have had to get blood transfusions. And let me explain to you why. When people with sickle cell I'm sorry if I keep looking down, I have everything written down that I'm going to talk about right here. But when people with sickle cell get blood transfusions, the blood transfusion is used to provide normal red blood cells in the patient's body. So there's a hemoglobin count. You have a hemoglobin count. And so if your hemoglobin is, I don't know how they exactly do this, but I know you have a hemoglobin count, and if the amount of cells, if it's too many cells in your body that are sickling, then you will have to unfortunately get a blood transfusion. I've heard from other people who have sickle cell that that's very hard, and I'll make another video on going more in depth in all these topics. If you want to, just leave a comment and let me know. Okay, now that we've gone through all of the things that come with sickle cell, I would like to go on and talk about the medications for sickle cell. The medication I take for sickle cell, every morning I take folic acid, which is a small pill. I used to take the chewable folic acids when I was a kid. They you know, it's really small. It's like a powder, what is it? Like a cream color, and you chew it and it tastes like vanilla. But now I take the ones that you don't chew and you swallow. I really like the ones that you chew because they kind of taste a little good. But that's besides the point. I take that every morning, and that is, folic acid is for your red blood cells, I believe. It's basically to make sure your red blood cells are healthy. That is what folic acid is for. When I have pain, when my pain first starts, I take ibuprofen. Now you can alternate with the ibuprofen. I want to say every so hours. I don't know the every so hours you can transition and take ibuprofen again. I'd say every 4 hours you take ibuprofen, and the pain is still there. You can take another one in the next 4 hours. That's for pain that is a little bearable. For pain that is really, really like it's like stabbing, like you feel it and it just won't go away, I take hydrocodone, and I believe I have the lowest dose of it. Yeah, there's also oxycodone, there's Percocets, there's also different medications that doctors give to people with sickle cell, but I personally am prescribed with hydrocodone. There's actually a percentage of Tylenol, and there's a percentage of hydrocodone. My hydrocodone is mostly Tylenol and a little bit of hydrocodone. So yes, so that's why if you're taking that medication, I don't know about any other medications, they also tell you like not to take Tylenol with it because it has some Tylenol in the hydrocodone. So yes, I have an inhaler pump. Now I do an inhaler pump. I pump the inhaler 3 times before any workout, and 3 times after the workout. Now why I do this is because I've had a lot of acute chest in the past. So just to make sure my lungs are okay and that I have a lot of wind and air flowing through them, I was prescribed an inhaler. So yes, people with sickle cell do have inhalers. A lot of people ask me when I bring out my inhaler, do you have asthma? No, I do not have asthma. It's just because of the acute chest and the damage. Another thing I would like to touch on with sports, and since we're talking about sports and the inhaler before exercise, I would also like to talk about your spleen. I get confused on which side my spleen's on sometimes, sorry. But people who have sickle cell oftentimes have to get their spleens removed. I've never had to, but I used to play basketball in middle school. And you know, basketball is a kind of a contact sport. So what my dad got me was these spleen pads. And I believe they're like rib pads, but they cover your spleen. And it's a shirt and it has a pad in it that covers your spleen. So if you're doing football, basketball, anything like that, I would advise you to get that. Or if you have a kid that's in a sport, I would advise you to get your kid that. Dance, even in dance, you need that. I would advise that, because you never know when somebody's going to make a wrong turn and hit your spleen. You never know. So you want to just stay protected. Now that I've covered that, back to the medications. I covered the medical medications that the doctors prescribe to you and stuff like that. Like I said, this is just kind of just giving a little information. I'll make a part 2 and go more into depth and stuff like that. Alkaline foods, besides medications that doctors give you to prevent pain crisis and prevent anything else, I would say make sure to eat alkaline foods. Hold on, I have an alkaline food chart on my phone. So alkaline foods are mainly vegetables. Yeah, they're mainly vegetables. So alfalfa, beets, broccoli, carrots, cabbage, celery, yams, zucchini, kale, garlic, peas, onions, okra, sprouts, lettuce, spinach. I love spinach. These are all foods that contain a lot of alkaline. You can also go in the store and get alkaline water. I'll make a separate video on what alkaline, how it's good for people with sickle cell, and the different foods and the different meals you can make. Just let me know if y'all want to see that. Yes, alkaline foods can help you prevent pain crisis. Alkaline foods help prevent pain. Okay, now the main important thing that you need to do if you have sickle cell disease, or if you know someone with sickle cell disease, please tell them, drink water. Drink water. Drink water. Like, I cannot stress this enough. This is what has helped me like through my whole life. All I drink is water. I don't drink anything else but water. And I drink a ton of water. I drink over the amount of water they say you should drink a day. Please drink water. Water is your best friend. Water and God have helped me battle sickle cell disease. So please, please, please drink water. If you are a parent, or and your kid has sickle cell disease, or you know your kid is going to have sickle cell disease, please grow them up on water. I promise you. My mom never gave me soda, never gave me juice. And all I know is water. All I drink is water. I don't like soda. I don't like how like it burns your throat. Like for me, it burns my throat. I don't like it. I don't really drink juice like that. So please, bring your child up if they have sickle cell disease, or even if they don't, bring them up with water. Nothing but water. I'm telling you, this will save you. This will save you. Now I would like to discuss different things that can also trigger, like things you don't even know that can trigger pain crisis and just result in bad things for people who have sickle cell disease that you didn't know. I'll make a different like in-depth video on this. Things that you didn't know, you never thought to search up. One, tattoos. Tattoos can actually result in a pain crisis. And it is usually tattoos on your limbs that can result in pain crisis. Number 2 is drinking alcohol. Drinking dehydrates you. So if you're over the age of 21, please, if you have sickle cell disease, please try not to drink a lot of alcohol. And if you do, I personally, I don't drink alcohol. I'm 18, but I would say to like make sure you're staying hydrated. Like make sure you have a water, and while you're drinking, you're like alternating water, alcohol, water. Like if you have to, please make sure you're drinking water with it. So those are the 2 things that you probably have never thought to search that can actually cause pain crisis and trigger pain with sickle cell disease. I like to talk about, next I'm going to talk about my experiences with sickle cell disease. Personally, a lot of times when I go and get checkups and I go see my doctors, they say that I am one of the lucky, I want to say lucky ones. I've never had to have a blood transfusion, and I haven't been in the hospital like that a lot. I used to go a lot to the emergency room and have pain crisis, acute chest, when I was younger, but now it's gotten a little better. Last year I actually went into the hospital and I had the flu. I was unresponsive. I had the flu. I'll also like to talk about that. Yeah, I'm sorry this video is all over the place. It's just a lot of things popping in my head at once, so I'm trying to just cover everything. I was actually unresponsive. My throat was hurting, and I don't know why, but I just went in my room and laid down, and I didn't wake up for like 2 days. I was still sleeping. I didn't know that. I was still sleeping in my room, and my grandma kept checking on me. Everybody kept checking on me, and I was unresponsive, so they decided to take me to the hospital because I was staying over my grandparents' house. So my mom was in here, so she's the one who usually takes care of me. She knows everything about sickle cell. She knows me like the back of her hand. But I was at my grandparents' house, so they called my dad, and they had to actually like take me down the stairs, and like I was unresponsive. And the thing I would like to tell everybody who has sickle cell disease is to make sure you tell someone if you're in pain. You tell them, even if the pain is not that bad yet, make sure you tell them, like, it could be a friend. Also, please make sure you tell your best friends. This can be tricky, but make sure you tell your best friends or someone you can trust or someone that you're with 24/7 that you do have sickle cell. Because if you tell them, say something happens to you, they can inform someone or inform the ambulance or the hospital that you have sickle cell. Also, like, just please tell someone if you're in pain. Tell your parents. Just speak up. I know a lot of times for me, I don't like to sometimes because when I was a kid, I wanted to feel normal. I didn't want to feel like I was different from everyone else, like I had sickle cell. Like, I just didn't want to, I didn't want to, like, and my mom was often the one, before school starts and you and your child can go and look at your teachers in the classroom. Well, a lot of times my mom was always the one telling every teacher I had, she has sickle cell, she has to take a lot of water breaks, she needs a lot of water, this and third. So, yes, please speak up, and just let everybody that you know is not going to somebody that you trust, like, because people don't always have the best intentions for you. So that's what I mean. Also, this semester I did not go on campus because of the whole coronavirus, and me having sickle cell disease, I have an underlying condition, so coronavirus and sickle cell disease would definitely not mix well. So I set this semester out, which was my first semester in college. I didn't go. I did everything online. Everyone did everything online, but they were just on campus doing everything online. So basically I saved a little money. My parents saved a little money, but I just sit this one out. I know some of y'all had to too, because don't mix well. But when you go to college, my doctors actually told me, when you go to college, you want to get a little safe to put your medicine in. People steal medicine. People will steal, and hydrocodone is an opioid, I believe. Yeah, it's an opioid. So people steal medicine these days. Like, people are crazy. So you always got to be on your P's and Q's. That's why I was telling you, everybody does not always have the best intentions for you. Some people actually, like, wish bad stuff on you. So please just, like, make sure you can trust them. So yeah, let me know what other sickle cell related videos or questions you have in the comments. Just let me know anything, like, do you want me to talk about anything anymore? Or yeah, but love you guys, and